Good morning to everyone. My name is Husnain Kremalli. I'm the Chief Medical Officer here at St. Mary's Hospital in Waterbury, Connecticut. Welcome to another edition of our Focus on Facebook Live. Each month we like to highlight a specific clinical area and expertise we're able to offer the community here from St. Mary's Hospital into Waterbury. And today we're really excited. We're changing it up a little bit. This week, of course, marks Nursing Week across the nation, May 6th to May 12th. May 12th being, of course, the birthday of Florence Nightingale, yes, who's the mother of nursing in sort of our world. And so I'm really excited to welcome Lisa Roy to be part of our group today. And nursing has gone through a bunch of changes. So welcome, Lisa, to our program this morning. Truly a powerful profession, nursing, super integral to what we do within the healthcare field. But even though we've been a couple of years removed after COVID, the impact not only within healthcare, but especially in nursing, continues to be something we're still working through. Yes. A number of nurses we found left the profession, which is unfortunate. They were at the front lines, truly our heroes on what was going on. And we're going to talk a little bit about a few things related to that. Number one, that focus. But then we're going to talk about how we're training new nurses with our nursing residency program, the different pieces of professional practice that you work on to enhance our program here. So, but before we get there, I want to start with you. You've been at St. Mary's for a while. Tell us your journey, what inspired you to get into nursing, and your time here at St. Mary's.
Okay, wonderful. Thank you for having me. And first, let me say Happy Nurses Week to all of my friends and colleagues. I appreciate all of you. My nursing journey was actually a little bit unorthodox. Okay. I am the daughter of a St. Mary's Hospital nurse.
Wow.
And I grew up here, and I didn't really think that healthcare was going to be my journey. Okay. When I left high school, I kind of branched out into something else, and something brought me back to Waterbury, and I kind of fell into an EMS kind of world. I did that for about 9 years, and then I realized that maybe Mom was right. Maybe this really was my place. Uh-huh. So I did apply to nursing school. I kind of got married, had children, applied to nursing school, kind of bundled it all together, and I was very fortunate to graduate right into the emergency department here at St. Mary's a number of years ago. So that's been my journey. I've been in the emergency department for over 20 years, and then I was fortunate to be able to become the emergency department educator, and then now move up into the professional practice department, overseeing a wonderful staff.
Gotcha. Well, I mean, I think it's remarkable. You know, you say maybe Mom was right. Well, when is Mom ever wrong?
Correct.
But they know a lot about us. So I'm excited, and thank you for sharing part of your journey with us. It's amazing how, and we've had a number of people who've come through the program here talk about the unorthodox nature sometimes of their journey. Allows us to sort of see things outside of the normal and then bring that experience back, which I love. Let's talk about nursing. Tell us your views on sort of where the nursing state is today compared to when you first started.
So, great question. I think that when I first started, in nursing, it was very robust. Everybody was working to get into nursing school. It was very competitive, as it is today. We didn't expect, or it was later after, again, a number of years later, that the Future of Nursing report put out that nurses were going to be retiring. We were going to have a mass exodus because of retirement, and then nobody expected COVID to come in. So here we are post-COVID, and surprisingly enough, 5 years later, and we're looking at nursing. It is a competitive program again to get into nursing school. And one of the things that I'd like to highlight is that nurses today are not just nurses graduating from high school and deciding that that's their career path. Many nurses find that nursing is a second job or second career for them, which is exciting because they bring life experience with them, and that's amazing, because when we look at patients and we talk about dealing with patients, that life experience is so very important. So I think that we have some building to do. I think that post-COVID and some of that moral distress and anxiety that came from COVID, we as nursing leaders need to recognize that in our new nurses, and we need to be able to foster growth and support them in their journey forward.
How are we doing that?
We're doing it in a number of ways, but one of the big ways that we're doing it here at St. Mary's Hospital is by our graduate nurse residency program.
Okay.
So our graduate nurse residency program is through the AACN BCEN nurse residency program, which is an evidence-based program. The nurses come in as graduate nurses, or anybody who's graduated within the last year.
Okay.
So you don't have to just graduate. You may be 9 months into nursing and decide that you may want to come here, and we go ahead and put you into our graduate nurse residency program. And really it is just to foster your growth. We bring you back. We offer skills. We offer seminars. We offer an evidence-based project, so we also work on your professional development. And we support the emotional, the skills, all of those little things that we don't think when we look at nurses. We think nurses come into practice. They graduate nursing school, they go into practice, and all of a sudden they learn all their skills, they jump into taking care of patients,
right.
And sometimes that little bit is a barrier. So we help foster and we help grow during the nurse residency program. They're able to come back once a month to 4-hour seminars. They have support from our nurse residency coordinator, Sally Silva. She does an amazing job with them, and they affectionately refer to her as Mama Sal.
Yes.
Because we all want to feel included, not
right.
only where we practice on the front lines, but also through the rest of the organization. So that's one of the ways we do
Well,
that.
it's remarkable the parallel that the nursing residency focus has with a physician's residency program. You know, and the way that they are so similar is uncanny. Because similarly, a physician graduates after 4 years of medical school, they've got that doctor title, nursing title from graduating, but there are some skills that they still need to refine in some degree, soft skills, hard skills that are helpful to develop their mastery into a particular area, which they don't necessarily learn during school, where there's such much more clinical, theoretical pieces of the puzzle. And then now you're taking that from theory, a little bit of practice, but really now focusing on true hands-on practice, which is remarkable. And then to hear how well connected they are to their team that's working with them as they go through that journey. Similarly to residency in medicine, we remember all of our resident friends that we had during that time forever.
Yes.
And you still kind of keep in touch with them every once in a while, and it's great to reconnect. And I'm sure it's very similarly with nursing residency.
I actually tell the residents many times that when you come into practice and you're with the group of nurse residents, it actually gives you a calming feeling if you're calling report to another floor and one of your co-residents picks up the phone to take report, and it really just gives you a sense of ease, like, oh, I know this person, I could definitely give report. But I do want to say that when we talk about coming into practice in theories, Patricia Benner's novice to expert theory really does kind of speak to most of what we are discussing today. Patricia Benner put her theory saying that we come into practice as a novice. After our first year of residency program, we actually move into an advanced beginner. Another year after that is where we start to feel competent, where we very, very much feel comfortable in nursing. And we continue not only after our year of nurse residency, but even that following year and forward, we do need to continue to foster and help support our new nurses in practice. So to get to that competent portion of nursing, we still need another year of skills and education and mentorship.
It's again very, very similar pathway that physicians come through, that nurses come through, and ultimately it leads to great patient care, which I think is what we're all striving for ultimately at the end of the day, keeping that patient in the center of what we do, but recognizing you can't necessarily jump from the school to the bedside without having a little bit of transition, because it is a big there is a big transition there.
There is.
And to have mentors to guide you along that pathway is remarkable. And is that part of that professional practice model that you've been talking about, sort of this, graduating, continuing to enhance your skills? Tell us a little bit about the professional practice model.
Absolutely. Our professional practice model really circles and our focus is right in the center about the patient and about exemplary outcomes. So we know that we want to have good outcomes with all of our patient encounters. So our model really focuses around innovation, it focuses around transformational leadership, and structural empowerment, which is huge. And in structural empowerment, we talk about professional governance or shared governance, and that brings our nurses to the forefront. So our professional practice model encourages nurses at the bedside through professional governance to be involved through unit-based councils to drive change in nursing practice. So nursing change should not come from the top down, because you're at the bedside.
Right.
You are the one seeing what is happening with your patients, and we have some absolutely amazing nurses that really work hard to say, this isn't working.
Right.
Let's look at what the evidence says and let's see how we can change it. And we bring that back, and that's part of that professional practice model in regards to that professional governance and make changes in patient care.
Again, it's beautiful to hear that our heroes at the front line are helping us get better.
Yes.
Like, it's not simply, let's just do the same thing again and again and again.
Correct.
Or somebody sitting around a table or a computer saying, hey, I've got a brilliant idea on how we can improve that. But it's because what we look at when we're sitting around the table in leadership is, well, what are the quality metrics that we're trying to achieve?
Yes.
And we sometimes struggle to say, hey, how can we improve or get something better? And the ideas that we have may not be translated into what's really happening at the bedside. And that concept of, well, let the people at the front line help you in leadership decide how to get to or help guide you on what's really going to work to get you to where you want to go. So it's fantastic to hear that.
I think what's really important too is our leadership, our coordinators and such are able to give the information to the frontline staff. And an example is our stroke program, to make sure that we are doing or we are in line with what the regulatory agency expects, getting our patients to CAT scan quickly, making sure that we are able to give antithrombolytics to stop a stroke or reverse a stroke. And if nurses understand what is expected and why we're doing things, I think nursing tends to be a competitive population, and I really think that they strive to do what is best.
Yeah.
So if you got your patient last time to CAT scan in 15 minutes, they may say, we can do better. And that's where we talk about that exemplary practice in the middle. We give them the information they need, and they do, here at St. Mary's, they do take that kind of lead and they run with it.
And then what's that next pathway? What are those next steps? You've been a nurse for a while on the floor. Are there then pathways that then lead up towards leadership in healthcare?
Oh yes. The first thing I would encourage anybody that finds that they have the means and the time to continue on in your professional growth. We offer many opportunities here at St. Mary's. We work with academic partners to be able to whether it be online programs, something that fits your academic growth.
Sure.
But also, we have leaders here in our organization that are wonderful mentors, and there are many different avenues for our nursing staff to choose. They can choose to become an educator, which I endorse.
Yes.
Education, managers, directors, things of that sort. And I think the most important part of that is the interest and the drive, and to just reach out and just say, this is what I'm interested in. And I think that's probably.
So let's go back to the bedside nurse. How do they serve as advocates for the patient?
Well, I think
and educators,
yes,
to their patients.
Yes, bedside nurses, they're the eyes and the ears.
Yeah.
They are the ones that see what is happening with their patients, and we have the ability here to be able to stop the line, to question, to say, I don't feel that this is actually working or this might be right, so I'm going to question the medication that was ordered or the test that was ordered to understand how it affects and why it benefits the patient. And that's in many ways how they advocate for patients, safe discharges and medication from home, things of that sort. So I think that that's really where our nurses advocate for our patients and where they become number one, reaching out to our interdisciplinary team.
And it's critical for us to remember, like you mentioned, they're the ones who are with the patients so often.
Absolutely.
They're there during all sorts of different times during their clinical period and serve as truly the eyes and the ears of what's going on at the bedside with the patient, minute to minute, hour to hour, to help the entire team move that patient forward in their journey. I was talking to my daughter earlier this morning, and she was like, she's in high school and they've been working through different professions as far as what are their different careers depending upon their likes and dislikes, and they've been exposed to a number of nurses. She's like, she was surprised by just how broad the career in nursing is. It's not just the bedside nurse, but there were so many non-clinical areas of nursing that she's like, I didn't know. And it's amazing to hear her bring that. So give us a little bit of insight about both the clinical and then maybe even the non-clinical areas that people after nursing or who are thinking about careers in nursing can pursue.
It's interesting you should say that. I do have 3 girls and none of them decided to go into nursing.
Okay.
Which is okay, but as they have grown older, they're kind of learning that maybe mom knows best, and 2 of them are entering healthcare in other avenues, more so in the radiology aspect. But you can come into nursing and do many things that advocate for a patient. It doesn't have to be at the bedside. It can certainly be through nurse navigator. So a nurse navigator is an excellent example of non-clinical nursing, where you speak with patients on the phone. You look at their medical trajectory and see, geez, did they get the right medications when they were discharged? Do they have a follow-up with their physicians?
Right.
Are they doing well? And basically anything that touches a patient but not actually touches a patient. So there's many different ways to touch a patient, correct? So you don't necessarily have to have hands-on to touch a patient, but there's many other ways to touch a patient, and that is one example.
And the nurse navigator role is critical in sort of guiding a patient through that journey, particularly with some of their more complex and even things that we don't always like. We think about. I think the prototypical nurse navigators in the oncology or the cancer field, where you have a nurse that's going to help you, and this is your next appointment, or this is where we need to go next, because it's very complex. But even in some of our other less complex or thought to be complex areas, but like things like diabetes, we can have a nurse navigator in diabetes who can help you with, how are you taking your medicines? Where's your next appointment? How are you doing on your sugars? Similarly with congestive heart failure or some of your heart conditions. How are you doing with this? How's your weight going? So it's amazing to hear these, again, non-direct, hands-on areas, but yet still using all that information that they've learned, the experience that they've had, and helping the patient continuing to live a very strong life.
And when we talk about social determinants of health or socioeconomic areas that you brought up for diabetes, Waterbury has a very large diabetic population here.
Yes.
So it is important, if you are somebody that wants to go into nursing and you don't feel that your hands-on aspect is where that works for you, there are many needs out in the community for nurses, and that's one example.
Diabetes, I think, is a conversation we have to have on a different day.
Yes.
It's a reading about where diabetes has gone in the United States, not just in the United States, but in the world.
Yes.
As a disease process, it's truly sad to hear and to read about it. But I think steps we need to take for the future. Let's talk about the nursing opportunities available at St. Mary's. Tell us more about that.
So, as I said, years ago when I graduated into nursing, I graduated right into the emergency department. I had a paramedic history, so I had some experience. It wasn't common those many years ago to hire graduate nurses into a critical care field.
Gotcha.
These days, though, along with the graduate nurse residency program, we support transition to practice into critical care units, into our med-surg units, into our emergency departments. So there are a number of areas to come into nursing practice here at St. Mary's Hospital, and we definitely just support your growth in those areas.
But we talked about a shortage of nursing. Nursing is short everywhere.
They are.
Why would a nurse choose, why have nurses, not should, because they have chosen, but why are they choosing to come to St. Mary's Hospital? What's the secret sauce, so to speak, that we've got here that makes the nursing career here so much more special?
Dr. Kremalli, I'm so happy you asked that question, because I say many times, what keeps me here at St. Mary's Hospital?
Right.
And we have something here, it's a family atmosphere, and many people that come in, we do occasionally host travel nurses that come into our institution for support because of the nursing shortage. And one of the things that they say when they leave, and some of them don't leave, and they say, we stay because of the people here.
Right.
We stay because it's a family atmosphere. And when I interview nurses or interviewed travel nurses and say, this is one of the things you'll find here, they come back and they say, you were right. I've never seen something like this. So I think that's very important to know, that it's a family atmosphere. We are not a overly large institution, so we work together not only within our units, but amongst our units to support each other. And again, in regards to professional development, our team definitely wants to make sure that you are supported out on the unit in your growth and your transition to practice.
I love to hear again that family feel. We've heard it a number of times on these talks. To hear it again and again and again, it's not something that we're just saying. It's true, and we see it on the floor. There's sometimes even our nurses will go out and travel. And then I've heard them coming back and saying, yeah, St. Mary's has got that special family feel, that collaboration, and it is amazing. And I want to thank you for continuing to maintain that. We've had great success here within the nursing realm, and it's part of your and your team's work that has gone on and done that, but also the rest of the nurses. I think the way you all work together, surrounding the patient and making sure that they're the focus, which is where, again, our quality experience and the quality that's delivered here, another grade A and leapfrog for everyone out there. But that comes from, again, high quality care at the patient level.
Correct.
And that has to happen because we've got great nurses.
Yes, and they're doing the work. I
doing
applaud the work they're doing.
Absolutely. So let's switch gears as we come closer to the end of our conversation. We like to ask a question, and something we've started to develop over the past few instances, where we have our previous guest ask the future guest a question. So this question comes from Dr. Abe D'Amato, who was here last time, one of our urologists, and he asks, what is something that you love doing outside of work?
Well, I am just a little bit away from being a future grandmother, so I think what I love doing outside of work is going to change a little bit, so I'm very excited about that. But one of the things that I do is I volunteer with the American Legion in my town, and we do a great deal of fundraising and supporting the veteran population, and I find that very rewarding.
That's wonderful. I'm glad to hear that. Thank you so much for doing that. Now, more from you. Now we're going to ask you to help us out. One of the things we have to find out, and it's my aunt's a nurse as well, and the clinical expertise, and a lot of my friends in nursing have helped me as a physician in a number of instances. So thank you to them as well. We need a pearl. We need a nugget of your knowledge to share with the audience.
I think what I would say to all of the nurses out there is find what you love to do. And when you find what you love to do with the type of nursing that you want to do, strive to do it well. Do it the best you can. So if emergency department nursing is not what you want to do, you have so many other avenues open. You can move to any other type of nursing. And find what it is and then do it well, because the ones that are going to reap that reward, not only as yourself, within yourself, but the patients. The patients can tell nurses that love being where they are, and that's because you do that. You love being where you are.
Beautiful. Thank you so much. And great words to live by for everyone. what you're doing, do it to your best of ability. Love what you're doing all the way around. And then, of course, we need a question from you. Yes, question for you, from you, for our next guest coming forward. We're not going to tell you who it is.
That's okay.
But a question for you.
It was funny because I think you mentioned this on Tier 3 the other day about Lisa always having an educational moment.
Yes.
And I think my question would be, what can we offer here at St. Mary's, regardless of what your role is, for an educational opportunity?
Okay.
What are we missing?
Wonderful. Well, we'll find out the answer from our next guests moving forward. Thank you again, Lisa, so much for joining us today. Happy Nurses Week to you as well.
Thank you.
And thank you all for joining us. We look forward to seeing you next time. Have a great day.